Good evening. Welcome to this Ask the Expert event focused on Stafford Hospital's newly expanded Level 2 Neonatal Intensive Care Unit. Tonight, a panel of experts will share helpful information about services offered at the Level 2 NICU, as well as what you can expect if your baby needs a NICU stay. We will answer your questions live as well. To submit a question for our panel, just drop it in the chat in Facebook. Let's meet our panelists. First, we have Dr. Joshua Attridge, Neonatologist with Children's National Hospital and Medical Director of the NICU at Mary Washington Hospital and the Neonatal Transport Team. Next, we have Dr. Allison Markowsky, Medical Director of the Children's National Pediatric Hospitalist Program at Mary Washington and Stafford Hospitals. We also have Terri Lamprinakos, Nurse Manager of Stafford Hospital's Level 2 Neonatal Intensive Care Unit, and Frances Peters, Lactation Consultant at Stafford Hospital. Welcome, and thanks for joining us this evening. Dr. Markowsky, I'd like you to start the program by telling our viewers a little bit about Stafford Hospital's newly expanded services with a Level 2 NICU. What has changed?
Hi, good evening. Thank you so much for having me today. I'm really excited to share a little bit about the services that we're offering at Stafford. So our Pediatric Hospitalist group is employed through Children's National, and our group has been at Stafford since 2012. And since that time, we've provided services in the intermediate level nursery where we can care for babies born at 34 weeks and up. And so over the past few years, we've been working to expand those services. And we're in the process of going down to be able to care for babies born 32 weeks and up. And this will better align with what the American Academy of Pediatrics defines as a Level 2 NICU. And so in the preparation to expand these services, it's involved a really large multidisciplinary team, and we've focused on education, training, equipment, and staffing. And a lot of the changes that we've implemented are not only preparing us to care for younger neonates, but also are helping to better support all the babies admitted to the NICU.
That's amazing. Thank you so much, Dr. Markowsky. Dr. Attridge, I'd like to ask you a little bit about the NICU experience. Having a baby that requires care in the NICU can be daunting, to say the least. What conditions or issues might warrant the need for NICU level care for a newborn?
Again, that's a great question, Ashley. Thanks for inviting me to be a part of this. So a normal pregnancy, people think about it in terms of 9 months. But we in the NICU sort of think of it in terms of weeks. And so a full-term pregnancy would be 40 weeks gestation. So the different criteria that can have a baby require a NICU stay is if they're born prematurely. So if they're less than a certain gestational age, they will automatically come to the NICU. Generally for us, it's less than 35 weeks. Other things that can cause a baby to come into the NICU is if they're small, so a certain size. So if they're growth restricted or they're not able to grow well on the inside. Those babies have some special challenges after they're born as far as keeping themselves warm or working on their feeding or able to keep their blood sugar up. And then there are some babies who aren't able to make the transition from intrauterine to extrauterine existence in life very easily. And so that's when babies are inside of mom, the placenta is doing all the work for them. And so they're able to get all the oxygen they need and all the nutrition that they need. But after a baby is born, some babies aren't able to maintain that for themselves. And so babies who have breathing problems can need to come into the NICU. Babies who have problems maintaining their sugar, or if there's any sign of any infection or anything else like that that we might have to treat. Those are the main conditions that we look for treating the NICU.
Great, thank you. Terri, can you talk a little bit about how a baby's care plan would be discussed? I'm assuming that when a baby needs to go into the NICU, there's a lot of conversation between the interdisciplinary team, the doctors, the nurses. So how is that information communicated with the family?
Yeah, so when a baby gets admitted to our NICU, we, of course, stabilize the patient first. And soon after bringing your baby into the NICU, we would have the nurse and the physician present who are on that day and talk to the parents at the bedside about the plan of care, what's going on with the baby, and any future testing or anything that the baby would need after, in the coming days.
Great. Francis, I'd like to ask you a little bit about breastfeeding as our lactation consultant. I know a lot of moms are really excited about that moment right after birth where, you know, they're going to start trying to breastfeed and trying to do skin to skin. And sometimes that can get interrupted if baby requires a NICU stay. So can you talk a little bit about whether you're able to breastfeed if your baby goes to the NICU and kind of what that would look like?
Thank you, Ashley. It's great to be here tonight. So as lactation consultants, we're there to support the mom and the baby, and we're committed to helping them on their breastfeeding journeys. And in the beginning, every baby's unique, so they may not always be ready to go to the breast right away. So lactation consultants are there to help establish breastfeeding, even if baby's not able to go to the breast right away. We can help the mom establish pumping and help her to get started with the process of establishing a full milk supply. And we're there to support her every step of the way.
That's amazing. The NICU can be kind of, I think, a daunting environment, and especially learning to breastfeed, learning to pump. What kind of setup or situation is there in the NICU? Are you able to pump in the NICU? Are you able to kind of breastfeed when your baby is there? How does that work?
So we have hospital grade pumps that are available, and they're also available inside the NICU for moms who want to pump at the bedside. That's an option. We also can have them pump in their rooms, and it's a hospital grade pump designed to help establish a full milk supply so that we can help moms wherever they feel most comfortable to get started pumping. And also when baby's ready to go to the breast, we're there to help assist with baby latching to the breast as well.
Awesome. You talked a little bit about hospital grade pumps. So Dr. Attridge, I'd like to kind of shift over to you so that you can talk to us a little bit about the equipment in the NICU. I know we all kind of have this picture of a NICU in our heads, and you know, there's lots of equipment and beeping and monitors and things like that. So can you talk a little bit about the equipment that's going to be used to support a NICU baby?
Definitely, that's a great question, Ashley. So one of the things that that we use in the NICU is that all the babies who come into the NICU are going to be monitored. And so they're going to be monitored usually on an electronic heart monitor that shows their heart rate, their respiratory rate, and then their oxygen levels. And so that's something that we're able to provide in the NICU that they're not able to do in the nursery or in the mother's and baby's room. So that's probably the first step. The next thing is really dependent on what the baby needs. And so there are some babies who are very small who aren't able to maintain their temperature. So they're going to go into an incubator or an isolette. That's going to be able to maintain the temperature around the baby so that they don't get cold or waste a lot of calories keeping themselves warm. A couple of the other things really depends on what their respiratory status is like. So if they're having trouble breathing, we may need to be giving them some oxygen or using some pressure to try to help open up their lungs and make it easier for them to breathe. And so all of those things play a part. Again, based on how premature the baby is, sometimes babies will need to be on a breathing support. So they might need to be on like a ventilator or something like that, or they may need to have a feeding tube or something if they're unable to take any feeds by mouth. And so that's something that we can still get. The best way to get babies nutrition is to give them food into their stomach. And the best thing we can give them is that breast milk that Francis was talking about. But some babies, because they're working so hard to breathe or they're just not mature enough, aren't able to do that yet. So there's other ways that we can do that. And I think one of the things that's great about the NICU at Stafford or at Mary Washington is that the nurses are there to kind of help walk the parents through all those different pieces that they're going to be seeing on their babies. Because, you know, when you have a baby, when you find out that you're pregnant or that you're going to have a child, no one ever plans that they're going to have a baby in the NICU. So it's really not part of that really thought process of what's going on. So I think that having someone there to guide you is really helpful. And that's what the nurses and the RTs and the therapists do, both at Stafford and at Mary Washington.
That's a great point, Dr. Attridge. Thank you. The nursing team is definitely an extremely incredible resource. So Terri, I'd kind of like to talk to you a little bit about that process and the nursing care. A lot of times, you know, we see the babies go to the NICU and they're in the isolate. So if a baby needs to go to the NICU, can the parents hold him? What does that kind of look like?
Yeah, so we encourage kangaroo care or skin to skin. And as long as the baby is stable and not too premature, we absolutely allow that at the bedside, as long as the baby's not hooked up to equipment that doesn't inhibit that. And if the baby is hooked up to equipment or too premature to hold, we encourage the parents to talk to their baby, read to their baby, sing, hold their hand, and sit at the bedside for as long as they need to.
Awesome. And talking about that, about sitting at the bedside and being, in that situation, going through that process. Dr. Markowsky, I'd like to kind of shift over to you so that you can talk to us a little bit about the emotional aspect. Having a child in the NICU, I'm sure, can be very challenging, very emotional for families. Can you share a little bit about how having these expanded services at Stafford Hospital is really going to impact our community?
Yeah, great question. So, having a baby be admitted or need to go to the NICU, it's usually not expected. It's usually not what parents are imagining, right prior to giving birth. And so it can be a stressful time for really everyone involved. And so, one of our goals in expanding the services is to expand those services to the community and hopefully be able to keep more babies at Stafford and closer to home, so that their families can be there to be seeing them, as much as they want, and not have to necessarily travel far away or have the emotional and financial stressors of that. So we're really just hoping to keep more babies in the community to really help out the families.
That's wonderful. It's a huge resource to the community, and I can't even imagine the process of having a baby in the NICU and having to travel. So knowing that they have these services and this care in the community is huge. So the point of the NICU, obviously, is to get the baby to a point where they can discharge home. So let's talk a little bit about what happens once baby is stabilized, once baby is ready to go home. So I'd like to ask Dr. Markowsky, if you can tell us a little bit, just in case baby's not ready to go home, what if baby needs a higher level of care, something that a level 2 NICU can't provide? What happens in that case?
Yeah, and so, we've talked a lot about these different levels, or we've mentioned them, level 2, 3, 4. And so these are state kind of guided different levels of neonatal care. And they really define kind of what services can be provided. And so a level 2 NICU can go down to 32 weeks and provide certain levels of support. But sometimes babies need a higher level of support, and that would be and then may need that higher level of care. So Mary Washington has a level 3 NICU, which provides almost all services for neonates. And then Children's National has a level 4, and that provides a lot more subspecialty care or surgical care. And so, again, if we aren't able to provide the services the baby needs, this higher level of services, we coordinate with either the Mary Washington team or the Children's National team to be able to transport them to those facilities. Mary Washington has a neonatal transport team, and so they're only about 10 miles down the road, and so they're able to come and help facilitate caring for the baby and transporting the baby to Mary Washington. One other thing that we've implemented that we started in the fall is telemedicine. So Dr. Attridge and his team are available 24/7 to our team at Stafford. And so if we want them kind of in real time to be able to see the baby, talk to us through a video conference, talk to the family, they're able to kind of through that telemedicine device, see right in and provide that real-time advice.
That's incredible. The telemedicine is amazing. Can we talk a little bit, Dr. Attridge, about how you determine how long a baby will be in the NICU? I expect that that's probably every parent's first question when they find that their baby is going to be admitted to the NICU is how long are they going to be here? So can you speak a little bit to that?
Definitely. So it's to be fair, it's usually the second question. The first question is my baby going to survive? And then, okay, yes, then when I get to go home. So there's no really magic day or time for when the baby gets to go home. A lot of it is based on what the baby is doing. And so, a length of stay could be as short as in the NICU, at least, 12 or 24 hours. And then we may move you out into the nursery to be in the room with the mom. Obviously, if you're born extremely prematurely, those babies can be in the NICU for months. And so we have some general criteria that we look for that we want babies to do before they're going home. So we want babies who are if they've had any breathing issues, We want to have them not have any breathing issues for at least usually 24 hours or so. So they're not on any extra oxygen, they're not on any other support of any kind. We want them to be big enough that they can maintain their temperature without needing an incubator. So they have to have a certain weight, usually it's about 4 pounds or so that we want them to be over. We want to make sure they're taking all their food in by mouth. Everything in the NICU is a calorie game. And so we're very judicious about counting calories, but that's because we want them all to gain weight. And so it's kind of the opposite then for me. But that's something that's important, because if we can give the babies enough calories, they're going to be able to figure out how to feed and how to keep themselves warm and everything else. We just need to be able to support them through that. So we really individualize for those babies sort of how long they're going to be there. But it is one of those first questions that parents ask. And generally what I tell parents is that if you're born prematurely, it's going to be maybe 1 to 3 weeks before their due date. If you're full term and you just need some help with getting over some respiratory stuff, then usually I'll say, well, let's see how they're doing in the morning, and I'll be able to give you a better sense of how things are going at that point.
Great. Wonderful. So Terri, I'd like to ask you a little bit about that. When parents are, their babies are admitted to the NICU and they might have to have a little bit longer of a stay, a couple of days or a week, and mom is going to be discharged. She's ready to be discharged from the hospital and baby's going to stay. My first question would be, do I really have to go home? Do I really have to leave my baby? So can you talk a little bit about that process and what that looks like?
Right. Yeah. It's a scary time and you don't want to leave the hospital, of course. We do offer a boarding program. So the mom, even if discharged from the hospital herself and she's no longer a patient, and the dad can stay either in their LDRP rooms that we have, or they can go onto another unit pending space for up to 3 nights. And that's subject to bed availability, but we try our hardest to get them to stay those 3 nights at least. And then if there's extenuating circumstances, we talk about extending that stay longer.
Okay, great. That's an amazing resource for families to keep everybody together, and that I'm sure encourages breastfeeding and all of that as well. So that's wonderful. Francis, can you talk a little bit about what resources are available once baby is discharged home after they've had, a NICU stay? What can we do to help them? What if they're struggling with breastfeeding? Can you tell us a little bit about what is available?
Yes, we have outpatient lactation services available at Mary Washington Hospital, and we hope someday in the future to have it also offered at Stafford Hospital. We have a new mom and baby support group every Friday morning, 9:30 to 11:30. So mothers who are struggling with breastfeeding are welcome to come and meet other mothers and get support for breastfeeding.
That's wonderful. That support group sounds like an incredible resource. What if I have multiple children? Can I bring siblings or?
Yes, you're welcome to bring siblings. We just ask anyone 2 and older to wear a mask while they're in the hospital.
Awesome. And that support group, that's at Stafford Hospital, is that right?
At Stafford Hospital every Friday morning, 9:30 to 11:30 on the ground floor. And you do not have to register. It's open for walk-ins.
Awesome. That sounds like a great place for new moms to get some support and make friends and really have a community. So that's incredible. Dr. Attridge, I would like to ask you about probably a smaller subset of our population, but still one that I'm sure is relevant to some people. So what happens if I'm expecting twins or triplets or multiples? Will my babies need the NICU, and what can I expect?
Yeah, that's another great question. So I think the goal for us in the NICU, and certainly with the OB doctors and the high-risk doctors, as long as the babies are growing well inside of the mom and the mom is doing well, I think everyone's goal is trying to have that pregnancy get as close to term as possible. And so it's not something that anyone is going to be excited about delivering babies prematurely. And so, one of the first things that I do when I meet with families who are in the hospital because they've got higher risk issues or other things like that is always reassure them that our goal is, as long as the baby is safe and you're safe, is to keep you pregnant as long as we can. But there are certainly situations that arise where that's not going to be possible. And so twins or multiples is a great example of that sometimes. There can be conditions with twins where one of the babies isn't growing as well, and there may be other indications that we need to deliver the babies early. And so when that happens, that's something that we set up in the NICU or in the in the NICU at Stafford to be able to manage that. We've had up to quadruplets at Mary Washington, and so we've had 4 different bays sort of set up so we can handle them all at once, and it's really it's pretty impressive when it does happen. But I think that in that type of situation, that's going to be an ongoing discussion, obviously, between your OB, maybe your high-risk doctor, and the NICU services to figure out what's going to be the optimal place for you to deliver, whether that's at Mary Washington or at Stafford.
Wonderful. Terri, I'd like to ask you a little bit about visitation guidelines. I know visitation in the NICU can be a little bit different than what's in the hospital. So can you tell us what to expect?
Yeah, so right now we're at level 1 visitation for the organization. So unlimited amount of visitors, just 4 people in the hospital at once. In the NICU, it's a little bit different. We ask that only 3 people are at the baby's bedside at once. And the 3 people can be both parents and then another family member or friend. And anyone who comes into the NICU has to do a 2-minute hand wash. And we ask that the visitors not be ill so that they're in good health, so that we can protect our most vulnerable patients and little babies there. But 3 people at a time, but there's no limit to how many people can rotate in.
Okay. Is there any limit to age? Like, can siblings come and visit?
Yeah, so 12 and up can come visit in the NICU, but we do allow the parents to FaceTime while they're in the NICU, as long as it's a quiet environment still. So they're younger children, they can video chat over that, and as long as there's not rounds going on and we're not violating other patients' privacy, we have curtains that we can pull, and they can do that FaceTime with those smaller siblings, and it's really fun to see.
That's wonderful. What happens if, I have to go home and I can't visit? Can I call to get updates? How often and who should I call?
Yeah, so your information is pretty much limitless. When you first get admitted to the NICU, we give you a folder with all the information on how to contact us if you do have to leave. So we give you the phone number to the NICU and to the NICU nurses. You can call 24/7 to talk to the NICU nurses, and if needed, they can get you in touch with the physicians as well. You do get a passcode to give to the NICU nurses so that we know that you are the person that we're supposed to be giving that private health information to. So you would just tell the nurse on the phone the passcode, and then we can give you updates throughout the whole day. So if you can't come visit one day, you can call as many times as you need to, and we'll give you updates. Yeah, on everything.
Awesome.
Yeah.
Awesome. That's wonderful. In talking kind of about communicating with the care team, Dr. Markowsky, will the baby have more than one doctor during their NICU stay? Is there a team of doctors? How does that work?
Yes, they'll likely have several different doctors during their stay, depending on how long they're there. Our team is in-house, so we're in the hospital 24/7. So if they ever need to reach one of us is always there. So given that, yes, we do take turns and rotate out and have different shifts. So they likely will meet several of us, but we hand off all information from one person to the next. So the new person coming on should be well informed about your baby's care and just be right up to speed with what's going on.
Great, thank you. Terri, I'd like to talk to you a little bit. Dr. Markowsky mentioned earlier that this expansion, Stafford's expansion to a level 2 NICU, involves a lot of extra training and new equipment and things like that. Can you talk a little bit about what advanced training the nurses received to expand these services?
Yeah, super excited to be here because this, like Dr. Markowsky said, this has been a 2-year project, if not longer. Every year, the nurses do simulation drills and, mock codes and things like that in their annual skills. But in preparing for this, expansion, we've added extra in-person classes. The NICU nurses and physicians at Mary Washington Hospital have come over and taught some of those classes with us. Dr. Markowsky and her team have done bedside training with all the nurses. We've added more codes and more drills. They were all given access to a NOAT program, which is kind of a comprehensive program for NICU babies and their care. So they did online modules and testing and things like that to prepare. So they've gotten extensive education over the last 2 years, and any new team members that come on, we also educate them on that and add them into our drills and mock codes. So we do those at least monthly, if not more. And we have, the partnership with the physicians as well. So it's an all-encompassing team thing. We add the LDRP nurses and staff to those drills too, so that, everybody can be all hands on deck when we have an emergency or need help.
Thank you. Thank you. That sounds like an amazing team, and a lot of hard work has gone into this expansion.
Yeah.
I'd also like to ask you, we kind of touched on this a little bit earlier, but having a baby in the NICU, I'm sure it can cause higher than usual levels of stress and anxiety for new parents, which is already a stressful and anxious time. So can you talk a little bit about how the nursing staff in the NICU kind of supports parents emotionally during this challenging time?
Yeah, so it starts on the LDRP side, the postpartum side, where we give every new mom a postpartum depression screening, and that kind of gives us like a baseline of where the moms are sitting. We have behavioral health partners and mental health partners that if that score is high, we get them involved right away to make sure that the mom is getting, the best care, and they can follow up with their, OB outpatient afterwards, and we have outpatient programs to support that. In-house, we have case management, social work, pastoral care that can help the patients as well going through those hard times. And then, of course, in the NICU, we have, like Dr. Markowsky said, there's a physician there 24/7, and there's a nurse taking care of your baby 24/7. So if you just need to sit down and talk, go over the plan, no matter how many times you need to go over it, ask questions, a shoulder to cry on, we're all here to help you.
That's incredible. It's really good to know that there are so many resources available and so much support. I think it's important for new moms to know that those things are available. So thank you for sharing that. I have one more question that I kind of like to open up to everyone. Dr. Attridge, Dr. Markowsky, especially, can you tell us kind of what your advice would be? How best could I support my baby if my baby needed the NICU stay? Kind of what are your best tips for how to navigate a NICU stay?
I think that probably, foremost among those is to really be involved as much as you can be. And I think that obviously the challenge of that is not knowing where to begin or how to start that. And really the NICU nurses and the therapists and the RTs who are there all the time really are going to be able to help you figure out ways to interact with the baby, to touch the baby. If we can do something like skin to skin, promoting that. So, because we know that that's something that helps decrease stress in the mom, we know that it helps decrease stress in the baby. Those are all really great ways to sort of start that process. And then I would say probably trying to not focus on the disease process maybe that they have, but just the baby, and really trying to focus on that ability to enjoy those moments where they're able to look at you and kind of have that bonding experience. It's hard because again, it's not what you expected. It's not that same type of scenario, and sometimes the babies aren't ready for that. But I think we feel very privileged to be able to provide the care to these babies, and so and we know that you're giving us that trust, and so trusting us to sort of help guide you as far as what are the best ways to interact and to work with them is really, really key. So those would be my 2 cents. I don't know what Dr. Markowsky has to add.
Yeah, no, I think that's great advice. And, I think to reiterate a little bit what Terri said too is, ask questions, and we're there to help, to reiterate, to repeat, questions that have been asked. So we're happy to kind of help go over things again. Sometimes on the first day, we don't have all the answers. We're still kind of looking into what's going on and trying to figure it out. We don't know when the baby's going to be able to be discharged. It's really one day, even 1 hour at a time. And so the plan often does change. And so I think, being patient with us, keep asking us to go through our thought process. And then just as Dr. Attridge said, be there with your baby, spend time with your baby. And we're there to help support you through that time as well.
Thank you. Thank you guys so much. We have answered all of our questions for tonight, but we did want to share a shout out to Dr. Attridge from a NICU patient or NICU parent. Their baby is doing fabulous and they are grateful for your help. So that's amazing. Thank you again to all our panelists. Thank you so much for sharing your time and your expertise. And thanks to you, our viewers, for tuning in to Ask the Expert. If you have questions about the neonatal intensive care units at Mary Washington or Stafford hospitals, or you want to learn more about services, we invite you to visit our website for additional resources. You can find us online at mybaby.mwhc.com. And be sure to watch Mary Washington Healthcare Facebook page and other social media channels to stay informed of the latest health and wellness information for our community. Again, many thanks for joining us this evening. Please stay safe and healthy and have a great night.
Thank you, Ashley.
Thank you, guys.